Hi, my name is Bibi. I'm a registered dietitian with the Child Care Health Program at Seattle-King County Public Health. I'm here to talk about transitioning babies to bottle feeding in a child care setting and how you can support parents. Before we talk about bottle feeding, let's remember that breast milk or human milk is the recommended first food for infants. Breast milk supplies all the necessary nutrients in the proper amounts and is recommended for the first 6 months. After 6 months, nutritious and safe solid foods can be added slowly, but providers should continue supporting parents in feeding the infant breast milk until they are 2 years or older, or for as long as the parent and child desire. Now, let's talk about bottle feeding, which could contain either breast milk or infant formula. It's important to keep in mind that the transition to a childcare setting can be challenging for parents and babies. Having a conversation with the parents about their baby's feeding habits will make it easier for everyone. Depending on how old the babies are, they will take a bottle a few or many times a day. For example, from birth to 4 months, babies tend to eat 8 to 12 times in 24 hours. 4 to 6 months old babies usually eat about 6 to 8 times in a day. At 6 months and older, they drink 4 or more times a day. Pay attention to early hunger cues, such as puckering, smacking, licking their lips, clenching their hands, putting their hands to their mouth, turning their head towards the chest or breast or bottom. Do you know that crying is usually their last option? First, ask the parent if the baby is already taking the bottle at home. Encourage parents to practice before the first day of childcare. The baby may have trouble accepting the bottle because they recognize that it's from a different person. If you and the baby are having trouble with feeding, hold the baby closely and securely. Have the parent bring in a blanket or burp cloth from home since their smell may trigger feeding. Talk to the baby gently to help them feel safe. And try walking while holding the baby in your arms as you offer the bottle. If babies show signs of refusal, such as turning their heads, arching their backs, closing their mouth, spitting up the milk, or trying to get away from the bottle, try paced bottle feeding, which slows down the flow of milk so that it is closer to breastfeeding or chest feeding. To do this, keep the bottle horizontal so that the nipple is partially full. Pause every 20 to 30 seconds during feedings to give the baby time to swallow. And watch the baby for cues to adjust the flow of milk. Or present the bottle in different positions. The age of the infant will affect how they should be positioned. For example, turning the baby away from your chest or moving them into a more upright position. Or adjusting your position so you are sitting differently, whichever way gets them to accept the bottle. Over time, adjust the baby to a position that allows them for eye contact, sensory development, and bonding. Other tips for successful bottle feeding include: offer the bottle when the infant is alert and not too hungry or too full. Give the baby the bottle as soon as you see hunger cues. Make sure the temperature of the milk is warm and not too cold, as breastfed infants are used to milk that is the same temperature as the human body. Suggest parents experiment with different bottles, nipples, cups like sippy cups or open cups. Finally, be patient and consistent. Remember that all humans, no matter what size or age, require some time and practice to learn a different or new skill. So be kind to yourself and the infant you are both learning. For more information and resources, please go to our website, kingcounty.gov/childcare.